Coming up, we will be on location at Nova Spine and Injury Center in Fairfax, Virginia, discussing effective treatments for lower back problems that so many of us suffer from with one of the Washington, D.C. area's top doctors of chiropractic, Dr. David Schaefer. Dr. Schaefer graduated from Palmer College of Chiropractic West and is one of the first chiropractors in the country to receive the prestigious certification of Advanced Practice Chiropractic Medicine. He has treated professional athletes from every major sport as well as Olympians. Welcome, Dr. Schaefer.
Thanks for coming out to see us today.
Oh, it's our pleasure to have you on with us. We've got a lot to talk about regarding an issue that so many of us, unfortunately, suffer from, lower back pain. And I wanted to start right off the bat, if I may, by asking you to tell us the specific problems that we experience with our lower back.
Well, people experience lower back pain for many different reasons, from simple sprain strains to more complicated injuries involving the discs and things like that. These can occur from simple little daily activities, from people picking up a piece of paper off the ground, to more traumatic injuries like car accidents and things like that.
And the types of issues that it causes as far as in the lower back region?
These people can have lower back pain, muscle spasms, pain down the leg, all kinds of different things, numbness, tingling. All these things can be associated with lower back problems.
Now, why are these problems so common?
Typically, a lot of these problems are becoming more and more common because of our lifestyles. You've always heard that you are what you eat, but I also believe that you are what you do. So sedentary lifestyles, changes in the workplace environment, a lot of these are really affecting the increase in lower back pain.
And what causes these problems specifically, Dr. Schaefer? Why do so many of us, millions of us literally, suffer?
The cause of these problems can be various things, but typically the most common reason why these problems occur is because of core strength. And it's a very popular thing in the fitness world right now is to strengthen the core and the trunk musculature. But because of our sedentary lifestyles, because of the changes in the workplace and things like that, we have a weak core, and that leaves us susceptible to injuries. So due to these problems with core strength, repetitive events like microtrauma, little things here and there, as well as serious accidents can cause a serious impact on the discs and the musculature of the lower back.
Who would be a typical candidate for the lower back treatments?
There's really not a typical patient. Typical patients would be anyone who having low back pain, pain down the leg, that's lasting more than 3 to 4 weeks. Studies show that 95% of back pain will disappear in 12 weeks. The issue is who has 12 weeks to let their back pain get away. You know, you have to get back into your life eventually. So that's where doctors like myself come in.
So on that note, what are the most effective treatments and how do they work?
It's really going to be dependent on the diagnosis of the patient. Proper diagnosis is always crucial for this. Treatments vary greatly from simple physical therapy to chiropractic care and more conservative sides to more invasive procedures like epidural injections and even surgery. Many experts believe that only 1% of patients are actually candidates, good candidates for surgical procedures.
Surgery should always be the last resort.
Yes, I believe that it should be the last resort. There are a lot of new technologies in conservative care that are really showing a lot of promise. IDD therapy, which is a type of spinal decompression, the use of cold laser therapies, and specialized rehab protocols and core strengthening with neuromuscular education with directed by computer programs are also very effective for treating lower back pain.
How would some of these work?
Well, with IDD therapy, it's actually a specialized type of traction. And what varies from other types of normal traction is that with regular traction, you can have complications of muscle spasm and things. You can't use a lot of pull for it. With the IDD therapy, because it pulls in a cyclical manner, you're able to increase the weights of the traction. And what this does is it allows for a negative pressure or a vacuum to occur inside the injured disc, and any bulging or protruding material is actually pulled back into the disc and helps to restore normal movement and reduce pain in the patient. This is done between 20 and 25 treatments, and it also uses different other technologies like cold laser therapies, which can help reduce pain and inflammation, and then finally it will be added in with a rehab protocol. And incorporating rehab into my protocols is very important. I worked a lot with a lot of athletes throughout my life, and the balance training that I do helps bring in dynamic stabilization. Life is dynamic. Life is not single plane. So you need to use balance when you do rehab, because then you prevent re-injury from patients who have chronic conditions.
Are the results permanent?
No treatment is really permanent when we're talking low back pain. The key to lower back pain is managing it and keeping the core strength there so that you don't have recurrences of pain. With the IDD therapy, the studies show that it can decrease pain anywhere from 70 to 95% with well-chosen patients. And again, diagnosis is always key.
That's a significant number, by the way.
Oh, very much so. The studies for a year follow-up with IDD therapy also shows that patients are still 76 to 79% improved without any other additional therapies.
That's significant.
Yes, it is. Anytime we can prevent a surgery or do something conservatively, it's always going to be the best choice.
Let me ask you, Dr. Schaefer, how safe are these treatments that you've mentioned?
Well, it's conservative care. There's always risks in any type of procedure, but for the gamut of procedures that are available, these type of therapies are very safe. Again, I need to stress that proper patient selection is always going to be key to any type of therapy.
Now, we've only got a few moments left, and I had to ask you, before I let you go, if you had any final thoughts that you'd like to share with our viewers.
With any type of condition, patients need to do their due diligence and really investigate the doctors that they're going to be seeing for their conditions. Make sure that your doctors have a background in treating low back pain and have experience with proper rehab, because that's truly what's going to keep back pain from coming back. And that's the goal of any doctor. It's not to see you in next month. It's to keep you out of their office. Back surgery statistics are alarming. In the United States, back surgery rates are 40% higher than any other westernized country.
That's fascinating, Dr. Schaefer. Why is that so high? I mean, why are we so much inclined to push patients towards surgery first, it seems, in some cases, as opposed to using it as a last resort option?
That's a great question. Over the last decade, spinal surgery rates have increased by 500% in the Medicare population. There was just a recent study in the Journal of American Medical Association that called the SPORT study that showed that outcomes, 1 to 2 year outcomes of patients who had surgery are identical to patients who had conservative care.
Now that's very interesting. Basically, you're getting the same result even a year, 2 years later from non-surgical options and treatments that you've mentioned here today earlier compared to surgical option. And if they're the same, then it's a no-brainer that one would rather not go through the surgery and try the non-invasive approach to see if we can be rehabbed and feel better, as opposed to going under the knife.
Yes, if it were my back, that's what I would take into my decision-making process. The risks involving surgery are much higher than conservative care.
Well, that was certainly very informative and very helpful, and I want to thank you on that note, Dr. Schaefer, for joining us and being a guest today on A New Me.
Thanks a lot, Rocco. I enjoyed it.
It's our pleasure.